Hi, I'm Shannon. I chose to do an article that I could relate to, and even though this article relates to females, I think males could probably relate to it as well. It is on the interpret the experiences of the brief cognitive behavioral group therapy on female university students who suffer from psychological distress. So, what is cognitive behavioral therapy? It helps you become aware of inaccurate or negative thinking so you can view challenging situations more clearly and respond to them in a more effective way. Um, how is the study conducted? You can't just pick anybody. Anybody could be stressed out. The selected people were between 22 and 45 years old, and they required not just to have psychological distress, but they had to score in the top 20% of depression and anxiety section of the symptom checklist 90. So there were 3 steps in this study: to measure the prevalence and level of psychological distress, a qualitative study of female college students' experiences and opinions about the brief Cbgt, which is cognitive behavioral group therapy. I don't want to keep saying that long word. Concerning the beneficial aspects of the therapy, and also a quasi-experimental study to measure the effectiveness of the short-term CBT-GT to decrease psychological distress. There were weekly groups sessions that were led by psychiatric nurses that lasted 2 hours, and they opened up with a breathing exercise, which is proved just to kind of calm you down, lower your anxiety, lower your heart rate, and also that was followed by educational presentation. So data was gathered from individuals in this study by answering a series of questions. Opening questions asked about their experiences in the therapy group. Some follow-up questions asked, what they thought helped the most out of the CBGT. The participants' thoughts towards the modules involved CBGT were qualitatively measured by psychiatric nurses. So what did they find? There were 4 common themes that were identical from students were: 1, gain knowledge and understanding; 2, become more balanced and positive in thinking; 3, to be more confidence in controlling oneself; and 4, wanting more opportunities for practice and in-depth reflection. It also stated in this article that individuals would feel that individual cognitive therapy would have also been very beneficial, since some people wouldn't really open up in like a group kind of setting, so they would like the individual aspect of that. So the women who fell into the themes in regards to gaining knowledge, understanding, stated that in the first one, CBGT increased their awareness and alertness to the beginning signs of psychological distress, and then they increased the use of cognitive and or behavioral skills that they have learned. 2, women who became more balanced and increased their positive thinking felt that their outlook on life had broadened, and they deliberately looked for more positive situations when they felt stressed. 3, the group of women who felt more self-confident and in control said they used different skills that they had learned in the educational sections of the CBGT, and also increased their self-control, and they felt that their self-confidence was enhanced. And the last group that wanted more sessions, more opportunities for increased in-depth reflection and education, stated that if the number of sessions were increased, individuals would have more opportunities to express themselves and be able to learn more cognitive behavioral skills. So, they really felt they needed more out of it. They didn't think the sessions were long enough. So, some people felt that way. Some people, learned a lot more in those, the brief therapy sessions. Group therapy worked well for them. So the findings of this study show that brief CBGT was helpful to female students for management of psychological stress. So the study shows that increased understanding of psychological stress, more positive and balanced thinking, and emotional behavioral control may help female students or prevent elevated psychological distress during stressful times. And we all know stressful times in school. I mean, you could have a really hard class, you can have a really hard professor, life circumstances, life things that happen that just add more stress, a lot of schoolwork being, a lot of pressure on you, and, and final exams, like, you could have 5 final exams all in a matter of a week, and it's beyond stressful, and almost sometimes people are so stressed and so anxious they just shut down and they can't see any positive going on. That's all they can focus on. So the researchers explain their findings. So the interview guide increased the dependability of the study findings, as well as all informants responded to the same questions. So basically this made sure that this study was going to be very accurate because it was very particular on the people that they chose to be in the study. Also, it says, the last question that was asked on our previous assignment, are there any alternative explanations for the findings other than what researchers proposed? So I don't feel there's any other findings. I really feel that, the female students reduce or prevent elevated psychological stress during stressful times. It is the direct effect of the Cbgt study that was conducted. The reason why these students, felt better after this study was because of the skills they learned in this therapy group. So I'm a big pro of cognitive behavioral therapy. I think it's a great tool. I think that even if you are in a stressful situation, you can always benefit. You can always benefit from it because you're going to come on stressful situations. You're going to, think, oh, everything sucks. This is going wrong. That is going wrong. But you have to, change your way of thinking. And I really like that they did a study on college students because, especially younger ones, and yeah, I'm a little older, but with the younger ones, they're still almost finding out who they are, especially if they just start out, they're, 18, 19, trying to, first years of college. It's stressful. So I really love that they did this study. And, yeah, that's it.